Good afternoon. Everybody doing well? Very good. Well, I appreciate you being here. This past weekend, we spent a great deal of time talking to different people around the state, finding out what was going on in other communities. Our knowledge of the test kit situation has been expanded considerably as we understand what has happened, both good and bad, in other communities. There is still a shortage of test kits all across the state. I will say that in the city of Mobile, there is testing being done for the patients of the different hospitals. If you are a patient of the different hospitals, they have the ability to test you. Also, that would include the Mostella Clinic and the Franklin Clinic on Martin Luther King Avenue, and that's information that we just picked up on. Over the weekend, we sent a task force to Birmingham to tour the drive-through facility at the Highlands. That facility, while it operated at a great capacity for 4 days during the week, they ended up overloading the lab because of the number of people that were being tested. What we have is a supply and demand situation, crisis, where there's not enough supply of the kits. And if you test too many people, then the laboratories at this time don't have the ability to run the test, which in some situations has resulted in negated tests because they weren't tested in time. That's just part of the learning curve. What you can count on, though, is that you will see more tests being developed. There have been regulations loosened, done away with, and so every laboratory that has the ability to produce a test is now looking at it, and the same thing would be true for the personal protective equipment. I think I saw recently where there's a call for 10 million N95 face masks, which are in short supply. So you will see the private sector step up and do things that they were not doing prior to this. Yesterday afternoon, I was on a call again with the 10 mayors of the largest cities, along with Senator Doug Jones. We spent an hour and 5 minutes. Each mayor weighed in, expressing their concerns, asking the senator to check on different things. The mood or the tempo of that meeting, the feeling in that meeting is that we need, to the degree that we can, keep our cities open. And the reason is because we can't let the health crisis become an economic crisis more than what it already is. There's a balance, and some think everything should be shut down. That was not the feeling that was expressed on that phone call yesterday because of the negative impact that completely shutting down everything would have. All of us are facing the same challenge, but if you look around, there is almost no one who is not taking this seriously, except for a few small groups, and every company is implementing some form of change in procedure in order to protect their employees. So that's what we will continue to do. We are following within the city the CDC guidelines, and we will continue to do that, or other guidelines that may come out of the governor's office. We have said almost every time we have come to the podium that our first and foremost concern is the health of our citizens, and that is correct. But I want to be a little bit more specific about that. If you really had to prioritize what are we trying to do and what is going to make the wheels of this community and other communities continue to roll forward, it is that the number one priority has to be the health of our healthcare providers. So to the degree that you have assets to protect the nurses and the doctors, that should be where those assets go. If there's testing, that's where they should go first. If the healthcare providers are the first tier, the second tier are going to be first responders. We have got to continue to have our fire rescue and our police available to be in the streets. When I say first responders, in my mind, that means something more really than just the police and fire. We have some mission critical employees that are just as important as the first responders, but if I named one, I would leave out another, and so I'm just going to leave it as the mission critical and first responders, that would be your second level. Knowing what we know today, there's a third tier, and that third tier happens to be our elderly, and specifically those that are located in our assisted living or in our nursing home facilities. There will be, in the coming days, you will hear increased conversation about what do we do to protect them, but also to make sure that should there be an outbreak like there was in the state of Washington or in New Orleans, how do you prevent that from getting out and being widespread in the community? So you will hear us continue to talk about the focus that we will have. We have already identified all of those facilities. We know where they are on a map. We have to verify, but we think we know how many beds are in each location, and we will start increasing our conversation with those facilities to help them make sure that they contain any illness that may arrive in those facilities. Just remind you, be remiss if I didn't, our hygiene from washing our hands is so important. Using hand sanitizer, the social distancing is, in my opinion, being taken very, very seriously. As very seldom do we see somebody that's not backing off from being in too close a proximity to others. I'd also say that there are a lot of people staying at home, and there are others that should you find out that you are sick, that you should stay at home. In city government, to the degree that we can, we're going to remain as fully active and providing all the services that we have been providing. The wheels of government have to continue, but we are allowing and making arrangements for teleworking, and also to make sure that our employees are comfortable in coming to work and doing the things that they need to do to provide the citizens the services they expect. To help business owners in the city, we are going to waive late payment fees for the months of February, March, and April on sales and lodging taxes. Also, we're encouraging anyone that's trying to do business with the city, especially in building and permits and so forth, to seek our online services or go to the city website to find out how you can do business without coming to City Hall. We are strongly encouraging transaction as much business as we can via our website or the telephone. Okay, I'd be glad to answer any questions that anyone has. Yes?
Going to the back to the deal with Synergy for the test kits in Mobile here, Synergy Labs. Are they actually producing the test, or are they ordering the equipment, meaning the swab and all that stuff?
So I would put them in the same category, really, Dale, with every other laboratory. All of them are trying to find suppliers for whatever they need to do the testing. And most of the suppliers, if not all of them, are in foreign countries. They're either in Italy or they're in China. And so almost, I could say, almost without exception, not just in the state of Alabama, but everywhere, they are waiting on supplies to get to them in order to be distributed. Part of the break in that supply chain, though, is that the federal government has, because of the emergency powers, they have diverted some supplies that may have been coming to Birmingham, and they've sent them to Chicago, just as an example.
When Synergy's up and running with the test, and we have the on-site drive-through testing facilities here in Mobile, do we know how many tests they can, the lab will be able to process per day?
We do not at this time. I don't know if the date, because it is a moving target. If I had been talking to them Friday, there's one answer today, it's something different. And so they're at the somewhat at the mercy of their suppliers, and they can't produce without those suppliers.
So it could be later days.
Yeah, it could. I'm uncertain when it may be. I know this, that they're in the same category with all laboratories. They are trying to determine what can they do, you know, in order to expedite and come out with something from either a screening standpoint or a test standpoint.
Do we have any more knowledge of when the Alabama Department of Public Health might have tests available for our local area?
We do not.
How important is this virus? Like, how important is this for the city of Mobile to get these test kits with the rapid spread of the virus?
It's very important to understand, you know, who has the illness. It's important for us to see if there's certain populations. So the bottom line, it's important. I mean,
The numbers are less, are more than what's being.
oh yes, I mean absolutely. The numbers are if you were to have 1,000 tests show up today, and if you had 1,000 people tested, you know, what's that curve going to look like? It's going to be a straight line looking like exponential growth. But that doesn't mean that it wasn't already here. But yes, we need to do the testing.
Infirmary Health, they started doing testing today. They're doing kind of a call-in, trying to keep it orderly so you don't see the big, massive crowds we've seen in Birmingham lining up on highways and that. When Synergy Lab starts doing the testing, what is the logistical issues in the process?
So the testing that's going to be done by the hospitals, let's take what the city would like to stand up. We want to be a tool or an instrument for the hospitals. And by that I mean, if you look at best practices that have evolved over the last week, just to test everybody is not a best practice. And the best practice is probably defined as testing those who have been referred to you by someone else. So we are wanting to partner with the 4 hospitals and let them send us patients to keep from blocking out their emergency rooms. And we've not worked out all the details, but we have been in almost continuous conversation Saturday, Sunday. I've actually at one of the hospitals today, hope to go to another one tomorrow. And the idea is that whenever the test kits become available, then we will set up an off-site place, but it's probably going to be by referral. There will be patients sent to that site by each of the 4 hospitals, or possibly Franklin Clinic, depending on how we work out the referrals. And at the end of the day, this is not a business that really the city wants to be in. It's out of our sphere of our direct responsibility, but we're doing it as a service to the hospitals in order to stand this up to assist them in doing that testing.
What's going to be taking the slots for this? Will it be Mobile County Health Department? Will it be Synergy Labs? Who's going to be?
So it would depend. Let's say like at Franklin Clinic today, they have a laboratory that they've been in business with, and so it's I'd rather not give out the name of the laboratory. It's not local, but they send those to that laboratory. There's 2 laboratories in Birmingham that do business with the Mobile Infirmary and with the University Hospital, and so that's where those samples are going. And so the kits are controlled by the supplier, being the lab, and they are giving it to those in the greatest need. So if you go back to the priority, healthcare providers first, so they're sending it, instead of sending it to the city of Mobile, they're going to send it to the healthcare providers, and then it will be the hospitals that in turn send it to us, because then we can help them with some of the testing to keep people from blocking out their emergency rooms.
I know you've spoken with Mayor Walmatic, who was one of the big 10 mayors.
Yeah.
They had a problem up there with spoiled tests.
Correct.
How can the city make sure? How can our city make sure that that doesn't happen here?
Okay, so we will not be in control of the test itself. We're going to set up the facility. We'll provide, I will say, the hardware for the facility, like refrigeration, bathrooms, and so forth. the crowd control mechanisms. But if we're working in partnership with the hospitals, we anticipate the hospital having either a nurse practitioner or nurses or some of their employees there in order to take the samples, maintain control of it, and then once the results are given, the hospital that has recommended that patient be there, they will follow up with the patient. The city of Mobile will never be in possession of that information in that chain of custody until the results are known, and then only if the HIPAA requirements change and the hospitals are allowed to tell the city, who the individuals are, will we have that information.
Mayor, is the city to provide any updates yet on the economic potential outlook fallout of this whole last week?
Yeah.
This crisis, will that be given tomorrow?
So, John, and we are working on that on a forecast right now, is what kind of hit are we going to take to revenue. All the mayors are working on that. It's a little premature for us to have that information. We're doing these projections, but it's too premature to say exactly what it will be at this point in time. There's some national statistics out saying that cities could expect 10 or 15% drop in revenue, but that's not verified at this point in time.
I talked to Chris Curry out the airport. He indicated maybe this could not affect the switch of commercial aviation eventually, but downtown actually might push it in that direction. Do you have any thoughts on that right now?
I don't know that I have a feel for that, John, but there are so many things in flux right now, so many things changing, that I wouldn't be surprised that, we think that it would have this impact, and in fact it has another impact, but I wouldn't be surprised. Yeah. I've made this comment to the several staff meetings that we've had today and to the hospitals. In a crisis situation, because everything is fluid and changing, today you may get a yes for a door that was closed on you yesterday. Somebody may have told you yesterday they couldn't do something, and that was right for yesterday. But because their circumstances changed, today they may be able to tell you they can help you, or that they have something that you need. And so as we continue to try to be creative and we try to solve some of these challenges that either individuals are having or businesses are having, we need to be thoughtful that every day is a new day, and that we need to look at it that way, and hopefully that we will find the way to get to yes to solve some of these challenges.
Mayor, 1/3 of the American population are being totally sheltered in place. I know you're worried about the economic impact of shutting down the city. Is that an option that is on the table right now? You have places like Louisiana, Ohio, or San Francisco.
It appears that except for in the very large cities, except for maybe a couple of very large cities, those calls are being made by the governors. And so yesterday the governor was very aware of what the 10 mayors were saying. My understanding is there are a lot of trade associations and others that have reached out to her. So that's a call for the governor. If we had a very unique situation happen in Mobile, Alabama, let's just say if you all of a sudden had an explosion of cases, and that you didn't see that anywhere else in the state, the governor may be compelled to do something, in the Mobile area. I don't know that, so it's all speculation about closing down right now.
Would you stand behind that? I know last week you were upset with the Mobile County Health Department putting the health order in place, closing
Yeah.
restaurants and dine-in. Would you stand behind if the governor
If the-
decided to close?
If the governor told us to close down, I would follow the governor's orders.
Mr. Mayor, is the city working with any other private providers to secure more testing done?
So over the weekend, we were in conversation with 2 other laboratories that provide test kits, at least 2, trying to find out what the availability was. But as far as other private providers, are you talking about to do the testing, or are you talking about test kits? Well, other than the 4 hospitals and Franklin Healthcare, we really at this point in time are not.
You got any idea, any numbers yet on how many people in Mobile or Mobile County
have been tested? I do not know, John, but I do not know. Okay. Thank you very much. Appreciate it.